Welcome back. Tobacco control is the subject this hour. South Africa must do more to help people quit smoking. We're told each year on the 31st of May, the World Health Organization hosts World No Tobacco Day. Now, the day aims to spread awareness about the risks of tobacco use and to encourage governments to implement effective tobacco control policies. So the theme this year is it challenges current smokers to commit to quit. Sam Filby is a research officer and lecturer at the University of Cape Town. She joins us now. Very good evening to you, and thank you so much for speaking to us. So let's talk about how big the movement is and how effective is it. And I'd like to talk about South Africa first.
Sure. So World No Tobacco Day is really a global event hosted by countries around the world. It has massive outreach. There are, in South Africa, around 8 million smokers. And, to try and curb the tobacco epidemic amongst those 8 million smokers is a community of tobacco control researchers, tobacco control activists, as well as government situated in the Department of Health. So it's a small team in South Africa compared to the number of smokers, but it's a hardworking team and they're driven to securing results.
Now, it's often spoken about the health benefits of quitting smoking. That's well documented. One sees it on the actual product itself. But it's also created a new movement, and that is of e-cigarettes, people thinking that they're getting healthier. In a way, it's a form of quitting. What is the latest research about this? And is there evidence that it can help avoid premature death?
So there's no what I would call credible scientific evidence to support the view that e-cigarettes or heated tobacco products are less harmful than their combustible counterparts. It's typically a rhetoric adopted by the tobacco industry, who is facing a period of declining cigarette sales. Regulation in South Africa and globally is moving towards eradicating cigarettes. People are very well informed, more informed than they were in the 90s and in the early 2000s about the harms of tobacco use. And so more people are incentivized to quit. The tobacco industry is facing declining sales. And so this is basically an opportunity for the tobacco industry to transform itself and continue selling some product to its customers. In terms of this evidence supporting that, there is no credible scientific evidence. And I would urge the public to consult the World Health Organization as a source of credible scientific evidence on the harms of e-cigarettes and heated tobacco product use.
Okay, so, while we're encouraging people to quit smoking, then let's look at the cessation strategy or even policy. Is there something that you can latch onto? If you are saying to people, go ahead.
For sure. So government currently has a tobacco control strategy which comprises legislation and increases in the excise tax. Legislation pertains to things like bans on indoor smoking, restrictions on tobacco advertising, promotion, and sponsorship, and the like. So what we have in South Africa is that kind of towards legislation excise taxes, but there's not really a tobacco cessation strategy. What exists is things that are driven by private organizations and not by governments. And so what we want the government to do is to take greater initiative in supporting smokers to quit smoking. And the World Health Organization provides very clear guidelines on what governments should do. For example, governments should be subsidizing nicotine replacement therapy for smokers. Right now, in South Africa, it is more expensive to buy a nicotine replacement therapy than it is to just continue smoking cigarettes. And so we made an urgent call in a piece in the conversation for the government to do more to support smokers when they do try and quit smoking, whether it's by subsidizing nicotine replacement therapy, whether it's by introducing a national toll-free hotline to try and help smokers to quit. That is what we're urging government to do.
So what would be a clinical service look like, or even a training facility to educate people, help them on how to quit smoking and doing it safely? Because some people would quit in order to then become addicted or to something else or use something else as a crutch.
No, for sure. And smoking is highly addictive, and it's completely understandable that when you're dealing with highly addictive substances, people may feel an incentive to substitute away from one addictive substance to another. What the World Health Organization advises is that government takes the lead by establishing smoking cessation clinics where people can go for a combination of behavioral therapy, whether that's cognitive behavioral therapy or just brief counseling support, as well as scientifically based medications to help people quit smoking. So it's not things like e-cigarettes and it's not things like heated tobacco products. Those have no scientific evidence base. It's about government subsidizing and supporting those people who want to quit in getting access to effective World Health Organization approved medications to assist them in their quitting journey.
Well, thank you so much for speaking to us. So we really do appreciate it. Sam Filby is a research officer and lecturer at the University of Cape Town. So let's take you back.